I'm not a psychiatrist, but I know that those disorders she's dealing with are most likely the reason why she thinks she's trans. Is it a person's responsibility to diagnose themselves, to be on the right type of medication, or is it the doctor's responsibility? You know, a doctor with a degree who's been in medical school. I'm not a psychiatrist, but I know that those disorders. I'm not a psychiatrist. I'm not a psychiatrist.
Hey everybody, we'll be watching through this video today where Marcus Dib, who calls himself the offensive T-word. I say he calls himself, I'm pretty sure, because he identifies as a trans man, I'm pretty sure he'd use he, him pronouns. Despite misgendering other people, I think probably because he decides that they're not adequately trans enough. I don't know, it gets confusing.
22-year-old Ains has over 154,000 followers on TikTok. Ains is a biological female and has been on testosterone since August 2022 and got top surgery in September 2023. Guess how long it took for Ains to get testosterone? 1 week.
Supposedly. I mean, I'm pretty sure that you wouldn't have a good understanding of that or what their past medical history was before that they had that appointment.
Ains's first appointment for testosterone was 1 week before Ains's first testosterone shot.
So I had my first T appointment yesterday. We talked about how long I've been dysphoric, what my goals for are transitioning wise, have I ever been to doctors regarding my gender stuff, am I in therapy for it. The doctor was literally the kindest human being I've ever met. If you're gonna see someone, try to see someone who specializes in trans care because I've never felt so cared for and listened to as a trans person.
Well, okay, so it sounds like this person is happy with the medical treatment that they've received. They dug into their medical history, went back into their past of previous medical appointments and therapy. They spoke about persistent gender incongruence, and they've made a decision that this person's happy with, their therapist is happy with. You know, I'm assuming then that's all good.
You might have thought that this trans doctor was super nice, loving, caring, and supportive. But here's the thing, they're only going to be this supportive if you identify as trans.
Isn't that kind of what you'd want in a trans care doctor? That they only support the people who are trans? I think it's a bit bizarre that you'd think that they wouldn't.
I used to have the same opinion about my trans doctor because she was super sweet and affirming, but it doesn't matter. We're human beings first, not trans. Doctors, psychiatrists, and therapists need to treat us as human beings first.
Okay, I'll try and get over the smarmy head wobbling that happens consistently. Okay, so you had a doctor and they were super kind and supportive for you, but they should have treated you more like a human. What does that mean? You're humans first? That doesn't even mean anything. This person was happy with the care that they received. They've got a diagnosis, which they still maintain is accurate. You have a diagnosis, which you still maintain is accurate. You say that your doctor had a lovely, approachable manner. I don't understand what could possibly have been wrong for you.
It took me years to understand that my trans doctor wasn't the person I thought she was. I almost thought she was a saint, a lifesaver, and so on.
Wow, you must have really had some profound relief from the treatment that you got from them. A lifesaver. You consider them to be a lifesaver and a saint, and they have great care. And they made a diagnosis which you're still happy with today. What a great job they did. Why not?
But I've been honest about this before, I didn't experience gatekeeping. It took me 6 months in total to be on testosterone.
Hang on, so you got testosterone within 6 months, and you think that that was no gatekeeping. What do you think that she did during those 6 months? Just sat and played Tetris?
It took me 3 appointments, under 3 hours in total, to change my entire life. And I gotta say, it's only due to pure luck that I'm happy today. Happy with my transition.
Hang on, so this person gave you 3 time-spaced appointments to establish that you had, well, I forget how it's phrased in the documents. Something like persistent, ongoing, and substantial gender dysphoria, which is something that you exhibited I'm sure, not just over those 6 months, but also had to evidence over a period of time before then. Seems to have worked quite well with you. They have a large body of evidence on which these decisions are made. Every large body of medical practitioners, every sort of large leading body of medical practitioners in different fields, endocrinology, nursing, pediatrics, you name it. All of the large medical bodies are aligned behind gender affirming care, and they release their documents which have got plenty of evidence and pointers to research. But you seem to know better. How would you know better than them? They made a decision which you are still pleased with today. Please explain. Okay, let's have a look.
It is not thanks to my doctor, because she's an ideologue. She is a trans activist. She believes that we should affirm, no
Hang on, so your doctor is following the recommended course of practice, and you're saying that the only reason she did that, a decision which you agree with, is because of an ideology. It's bizarre.
matter what the patient says, no matter how many red flags trans doctors see in their patients, they don't want to tell the patients that they're not trans. If your trans doctor actually cared about you, if my trans doctor actually cared about me, we would experience just a little bit pushback before making such a permanent decision.
What do you think a 6-month wait before you're allowed to take hormones is? Particularly a 6-month wait where you'd have had to have turned up evidencing prolonged gender incongruence anyway, right? I think that you're misrepresenting here in order to make a point.
If our trans doctors actually cared about us, they would have done their jobs, figure out what's going on inside of our heads. They would do a thorough assessment before giving us medicine that will forever change our bodies. But they didn't. There's a detransitioner in my country who had the exact same experience as me, the exact same doctor.
Right, okay, so you found one detransitioner in your entire country who saw your doctor and detransitioned. Firstly, you haven't said what kind of standards they received, but secondly, sounds like they would have had to have waited at least 6 months and shown evidence of their past gender incongruence before getting onto it. Did they lie? It's bizarre. You would expect, if you're saying that this is inadequate, surely you'd expect many detransitioners. I bet there's many more trans people in your country than there are detransitioners. Surely that should not be the case, if what you're saying is true.
Let me repeat, it's only due to pure luck that I'm not detransitioning today.
Is it? It wasn't anything to do with the many years of medical research that go into establishing the standards of care. It's nothing to do with the fact that your medical practitioner has many years of research, that they're following guidance, that, it's just luck. Absolute blind luck.
I just so happened to be right about what I was going through was gender dysphoria. And
They have tests for these things, and you will have completed them saying that you had long-standing histories of these things. So,
not something else. What's scary about Ain's story is she actually struggles with her mental health. She's quite open about her mental health issues. She did this TikTok trend saying this trend, but with my mental disorders, ADHD, OCD, bipolar. That is a lot to deal with. This screenshot right here should, according to her doctor, be the biggest red flag, and should conclude that she shouldn't receive testosterone, because going through a medical gender transition will not alleviate symptoms of OCD, ADHD, borderline, or bipolar disorder.
Pretty sure you don't have any medical training. What business do you have telling people that the diagnosis is wrong? If I were this doctor and I was watching your video, I'd probably hit you with a defamation lawsuit because you've got no standing to say this and no evidence to say it. It's absolutely astounding that you can make this case.
I'm not a psychiatrist, but I know that those disorders she's dealing with are most likely the reason why she thinks she's trans.
Okay, right, so he's not a psychiatrist, yet here, let me deliver my diagnosis. I'm going to give you a differential diagnosis on this because I've got zero medical training. And yet, for some reason, I feel like I'm able to overrule their doctor.
especially the bipolar disorder. It is a known fact that many with bipolar disorder go through identity crisis. Another red flag that Ains is
Well, I mean, come on. So if you're trying to say this person has complex medical health conditions, then surely that means it's even more important that they're seen by a specialist rather than just diagnosed by some idiot on YouTube who thinks they know better than everybody else.
doctor should have noticed is how Ains looks like a woman when she's applying for testosterone.
Hi, my name is Ains. I use he, him pronouns, and this is my first day on testosterone.
She looks 100% like a pretty young lady, feminine young woman.
You know what I think is weird? When people come at me and are like, you're not a trans man. You don't even look like a man. Do you think I just inject testosterone once and I'm like, oh, man time? It takes years.
You know as much as we do. That's not what your critics are talking about. We are all wondering how you are able to be comfortable looking like a woman when claiming to be a trans man.
Okay, so what? A person... I mean, firstly, I would argue that they didn't look like a woman. I mean, they were wearing like a flannel shirt, which if you have to associate with a gender, then you probably put it with a male gender. And then they had sort of shoulder-length hair, which loads of guys have, and like a nose piercing, which, again, if you're going to gender, I'll probably put sort of facial piercings on a more sort of masculine side. But really, these things aren't gendered. I don't know what you're talking about. And I think it's particularly surprising coming from somebody who posts this as their transition picture for before and after on Twitter. It's, somebody who's put this picture up is obviously comfortable showing pictures of them before transition, and somebody who before transition was very comfortable looking like, what was the expression he used? A pretty young lady? So, I mean, I think this is completely hypocritical.
You cannot be a woman looking like such while identifying as a trans man. You cannot deal with gender dysphoria if you're comfortable looking like your birth sex. I'll use myself as an example. I'll put up some pictures of myself. Before I started my medical transition, I tried as hard as I could, with only using clothing, changing my hairstyle and so on, to look like a boy, to look like a young man. Do you know why I did that? It was due to my gender dysphoria, due to feeling claustrophobic, feeling like I didn't belong in my own body.
Okay, so a trans person can never look at all, a trans man can never look at all feminine before all of their injections and transition and stuff. And yet this picture is on your own Twitter profile, so hypocrite.
All real transsexuals naturally look more and more like the opposite sex the older they get. It's so important for all real transsexuals to try living life as the opposite sex, but without the medicine, without the medical transition. It makes sense, right? What if someone can alleviate their gender dysphoria without going through the medical transition? Wouldn't that be a good thing? Why change your body if you're comfortable with your body to begin with? And you can't convince me that you were uncomfortable. I know what it's like. You can't fool me, a real transsexual. You can't fool Buck Angel or Blair White. We actually deal with gender dysphoria. We have dealt with it every single day. Felt the pain. Felt the claustrophobia. Sometimes we couldn't even go outside. But you're comfortable looking like a woman, a feminine woman, I might add, filming it and post videos on TikTok.
And yet here you are, outside, dressed as a woman that you posted on your own you posted on your own Twitter feed. A Twitter feed which is completely obsessed with your trans situation. And you've really made it your whole identity, haven't you? Really, I think, you need to calm down with this. It's a little much.
Even after her transition, she's still quite obsessed with trans.
So I took every single needle and syringe and vial of testosterone that I used from over a year and 3 months on HRT injections, and I threw them on a canvas.
I know I can speak for so many transsexuals, the real kind. When we have transitioned, we move on.
Right. Okay. I mean, that doesn't sound like you. I mean, we're just looking at your Twitter feed. Well, let's have a look at it again. So this is you, right? This is you posting pictures of trans stuff all the time yourself. Oh, there you are. Yeah. So Marcus Dib, who is apparently a biological woman living as a man, who's made their identity completely based around this issue, posts on it constantly. It seems to be the only thing that they name themselves after it. They post pictures of their transition. I mean, seems like you're more obsessed than they are. All they did was make a picture out of the old bits of their medication stuff for something that's profoundly affected their life.
Didn't transition just to be trans. We want to live our lives as if we were born as the opposite sex. When my mental health got better, I wanted to move on more and more. And I know some of you might be in the comments saying, why do you care so much about what an adult did? I'm making this video, I'm saying what I'm saying because I'm worried. I'm worried about the women, the men who are struggling with their mental health, desperate for answers, desperate to feel this inner peace, who get wrongfully diagnosed, get wrongfully treated. The fake trans people in my videos, the adults, are literally victims of medical malpractice.
I mean, you have no basis for saying this. You're an actual hypocrite.
I react to so many men and women on my channel that do not struggle with gender dysphoria, but very specific disorders, such as borderline, that's a huge one, or bipolar disorder, eating disorders, and so on. But they receive the exact same medical treatment as me and other transsexuals. Why is it even necessary for me to explain why I care? I have been through this famous transition that everyone talks about. I feel comfortable in my skin. Due to the transition, I'm finally happy. But all of these other people are not happy, truly happy, and they still don't feel at peace with themselves.
Who are they? Show us the evidence that these people exist in any kind of significant number. You know, what percentage of this of the people who transition experience regret? I think that's probably really important piece of information that you're kind of insinuating is a large figure, but you're providing no evidence to support that.
It makes me upset. It makes me angry on their behalf. Let me end the video by asking you all this. Can an adult who's mentally ill consent to going through the medical transition, even though they're not truly trans?
Can an adult let's wind that back on and see how he phrases this.
All this. Can an adult who's mentally ill consent to going through the medical transition?
Can an adult who's mentally ill? Now, it's really interesting because as he talks about his transition, he talks about the fact that as his mental health improved and whatever, as he was going through his transition, and then that's understandable because most people, I think, who are going to go through transition, I would expect to have some kind of, well, if you've got dysphoria, you'd expect that to have negative mental effects like depression and such. So I'm guessing that's fairly common. Certainly this person has already alluded to the fact that they had mental illness before they went in, so surely they shouldn't have been allowed to transition either.
Even though they're not truly trans, it wouldn't improve their mental health. It would actually just destroy them. Are mentally ill people responsible for their own medical treatment? Is it a mentally ill person's responsibility to diagnose themselves, to be on the right type of medication?
No, it really isn't, which is exactly why you should stop trying to diagnose other people. You're not their medical health practitioner. They're not their medical health practitioner. They need to listen to their medical health practitioner.
Or is it the doctor's responsibility? You know, a doctor with a degree who's been in medical school.
It's bizarre. You're just arguing that the doctor who you're just maligning are the exact people that we should listen to and not listen to people who have no medical experience. It's bizarre how you're making this argument whilst at the same time saying that we should ignore medical practitioners in the field and listen to you with no medical experience.
Do you think that it's fair for mentally ill people to deal with the consequences of going through the medical transition, get their lives destroyed, their fertility, their bone health overall destroyed just because they're adults? Do you actually think they can make that decision? Or do you think there should also be gatekeeping for adults? Gatekeeping meaning safekeeping. Let me know in the comments down below.
Yeah, okay, that's it. Thanks very much, guys. Bye-bye.
Most of the trans people you see today in the media identify such transition due to the concept called social contagion.
From the concept called social contagion. Yeah, well, I think we can see that you're really not a psychiatrist, because if you were a psychiatrist, you'd have known it's social contagion, not social contagion. I mean, your lack of experience in the area is really showing, and then yet you're out here not only re-diagnosing people who you've never met, whilst at the same time saying that the people who initially diagnosed them didn't have adequate time with them, yet you've never met them and you're diagnosing them.